My name's Billy Fitzjohn. I'm an Associate Director at Howden, looking after the education division. So I'm responsible for supporting the teams to support our clients in the education sector, from schools through to universities. I've been here for over 13 years and working in the education sector for just under 15 years as a whole. I think it all starts with the core part around actually supporting our clients and what they need beyond just a simple insurance product, mixed in with our history and heritage. So, having been around now for nearly 60 years, created from the student movement, our experience has always been about supporting our education clients to support themselves and support their students. So, we looked at it and very much saw that our clients, universities, students' unions, accommodation providers, schools, academy trusts, were telling us we have a challenge around mental health and well-being, and therefore we asked ourselves, what can we do to support this, which will ultimately support them and help them as an institution. When we started to recognise the challenge, this was very much about how can we complement and support what is already there. You know, universities and other education providers will have fantastic teams and people on the ground supporting the well-being and mental health of their students and their staff and their wider community. But this is about collaborative team effort to be able to provide a solution. So we asked ourselves, what part can we play in that? And what we saw, particularly at universities, were there were a number of areas that they were struggling to support themselves. So typically out of hours support, but also supporting students at risk as well. And those challenges have sort of grown and evolved through there. So it's really important that any education establishment or any organisation, looks to collaborate when trying to meet a challenge. So that's not just with ourselves, but when it comes to well-being, for example, universities need to be working with local partners, state services, and other areas to meet the challenge, because it's ultimately not something that can be solved by any one person or one organisation. For us, our wellbeing program very much started in higher education. We're now really proud to support so many colleges in further education, and we've recently extended the program and services we provide to schools, because we're seeing very similar challenges. Mental health and wellbeing isn't just, the challenges don't just exist or come out when a student is in higher education. We're very much seeing that happen at a much younger age. So there's some pretty damning statistics, really, of the amount of young people and children that are waiting for support. So we estimate nearly 1 million young people are looking for mental health support and can't currently get it quick enough in the UK. But also beyond just the pupils themselves, schools, are facing lots of challenges. Challenges to actually provide solutions when it comes to their budgets and their own methods of supporting. But we're also seeing a massive increase in the parent and guardian challenge. So, I've spoken to many schools who tell us that the parents' pressure and worries around mental health and well-being is now coming into the school. So they are getting questions, they're getting queries, and they're getting asked, how can they support? I've heard phrases like, our parents are lost. They're not sure how to support the mental health of well-being of young people. I saw a recent statistic that said only just over 20% of young people would feel confident having a conversation with their parent or guardian about their mental health or well-being. We want to change that. We want to create and empower parents and guardians to be able to support their children in this important area. So the challenges are very similar to colleges, to universities, but there are obviously some nuances with the age pupils are, really. We've extended our student assistance program. We now can provide a similar type of program through to schools, multi-academy trusts, secondary and primary schools as well. And that is designed to support the school as a whole. So not just the pupils themselves, but the staff. We've got staff who are looking to be educators, not necessarily dealing or having to deal with all of the challenges that they experience sometimes on the front line, and we want to support them, and parents as well, so that the parent experience and expectation there as well. So our program can support in a variety of ways, but when it comes to the parent and guardian element in particular, we have a caregiver helpline, and also digital app that supports any caregiver, whether that's a staff member, a parent or a guardian, and it's designed specifically to help them help a young person with their mental health or well-being, and that can be accessed at any time of the day or night, and a school can receive that access from us as part of our partnership. What do we provide the institution? So, we're there to support the institution as a whole, to complement their existing wellbeing provision. But ultimately, what does the student, the young person, receive? So it gives them 24/7 access to a qualified mental health clinician any time of the day or night, any day of the year. And that is for an in-the-moment, solution-focused conversation or chat that can support them. And they can use that as many times as they need to. They also have digital tools, so an app where they can use that to support their well-being. But also many of our education partners also, through us, provide students with access to structured counselling, either in person or virtual counselling, which supports the students who need that further support than just an in-the-moment conversation. So that really helps because it alleviates the pressure on internal services by providing that day and night, for example. But it also complements the existing provision by our things like our risk protocols. So if a student is presented to be a high risk, we will work with the university or the education establishment to make sure that student remains safe and is supported at all times. Some of our biggest successes, I think the main one is we're very proud, since launching the student assistance program just over 4 years ago now, and then extending that support to our accommodation providers, our student accommodation providers. Over 1 million young people now receive access to mental health support in a way that they perhaps didn't before. And we work with over 120 universities and colleges on a more comprehensive program level. So I think that's the biggest achievement, firstly, to say we've given that support, but I don't think it stops there. There are lots of student stories and case studies that we can share. For example, one university recently told me that in the last 12 months, we've supported roughly 1,500 students for counselling that they wouldn't have been able to support themselves in the last 12 months through a really seamless referral system, working in partnership with that university to get those students help and support as quickly as possible. In our area, we have nearly 60 years of experience of working in the education movement. So it's actually understanding our education providers and what their needs and requirements are and what their challenges are, but then complement that with the scale of Howden, one of the largest brokers in the world, and the scale and the access we have to different products and services that we can give our clients to help them, achieve what they're looking to do. And again, go back to that point around allowing them to be educators and provide world-class education for their young people and for their staff to be supported, allowing us at Howden then to support them around insurance, risk, well-being. I think that's one of the reasons why they choose us.